Okay, once more, na question on Cabo. Na my name Timu John Fuller. Na me the presenter for the Bodi, Beteh Gentri program. When a Salomon don't land book book, let Dr. Turay so. Now they bring this program to now. Me just then also as somebody where they facilitate. Me not a medical person. Me are just like a owner. I not have been nothing. Na land myself the land. Me a business IT consultant. Na IT me sabi and security. Na then me sabi IT security is like cyber security and stuff. Na then they me sabi. But as far as medical stuff is concerned, then people are then get boku book. The team not just Dr. Turay. Una will be done join before una know. But I know that the first time we get a lot of other doctors them with some based in the UK, some based in America, Germany, and different parts of the world. They all practice and specialize in various medical fields. So if you get question for ask, feel free for ask. The family there's only a small disclaimer though. If you not ask question and we're able to answer, not to say not be the answer, now because if not personal question, we not they give personalized advice. Not to say we don't want to give, not because we not get to a medical background. For us to make that informed decision and make no go give una. So any advice we they give na general advice. Furthermore, if you hear any situation way similar to you or any story way similar to you, a similar number than similar, we know they talk directly at you, not to your story we tell. Okay. So as I will say, today now 77th session. On our way at the first in this January. We don't take 3 years, they go 4 years now, or maybe we don't pass 4 years now. Anyway. We don't run for a while now, so I can see there was a time where we do them every week. Now we do them every month. Okay. And today we'll talk about diabetes. We don't understand the health complications. Okay. And today, Sunday, the 7th of July, 2024, and Dr. Mohamed Turay, they present to us today. His bra, not to Yaso no Melano. They don't learn from salon, so for be very, 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 very proud of that we able to produce doctors, then we able learn that salon and can have so can pass the exams now able to practice now. And I can say, I mean, John Fuller, the team is Itma for Timu. And the panelists, them where we get, that they will Bodi Beteh Gentri, panelists, them, as I say before, they specialize in various fields. We will try to answer as many questions as possible. And as I say before, we already have a group, we know they get paid, and they do this free of charge. We just see them fit say, with people, them, they suffer, and so 10 days somebody die, some of the people they die, not to a lack of just the medicine them, something like just a lack of knowledge. And this information that they get now, and I think if you go see doctor for consultation, it cost you a lot of money while we they give them for free. However, I will continue to make an appeal that if anybody they in the panel or sabi anybody we they not tongue, we get access to media, yeah, let them talk to them. We no go pay, because we give material for free. However, if they prepare for show the material for free, we're happy for getting the material as many as they want, and then can doctor them and put them on for other people them benefit from the program. Okay. So as I've said before, the program they get recorded, they go there on Facebook and YouTube. We also get a WhatsApp group. I will share the WhatsApp group link later. The group, however, una no able post it. Now we don't more the panelists and how we get posted. The reason being one reduce the amount of information where they get posted, and also the type of information, only medical information they get posted on that group. Medical information will go help and people them, whether back home or in any part of the world. Now, medical information will help with. So for reduce, the unfiltered information, I make we restrict the access. Okay. Yeah. As I said before, if you want to ask any question, if you brave and bold like me, you just ask your hand. If I see you, I will come to you there. If I not see you quick, it not mean say I ignore. It just means I not see you quick. But once I see you, I will come to you. However, if you technology savvy, you way around technology. If you look at your display right now, it will look like this. If you press these 3 buttons here, it will come up like this. And if you press this, you can chat, send me a message. If you're in an environment we're not good for public viewing, you turn your camera off. You use this for chat. Or if you ask a question, you can raise your hand by pressing this thing. It is show a raise hand at the screen. I will see say you want to ask a question. Okay. So, if I'm them, another you give me boku talk. Like come on the screen, I can read the bookman. We now can see. And if I get any feedback, we not be getting for feel say we not make mistake. If we make any mistake or something, they will not sabi. On a feel so we can able improve, send we an email now. Or like I say, send me, contact me on WhatsApp. And tell me what we need for improvement. If there's any subject that we want to listen to, please tell me. Apart from that, I thank you very much. I hand over now to Dr. Turay And while they present, anybody who join late, I'll therefore mute everybody for give Dr. Turay time for they present. I'm going to introduce yourself in waiting is specializing, and it will take me through the subject today. Thank you very much. Dr. Turay.
Hello, Dr. Mr. Fuller. Thank you so much, Mifambulem. We tell you thank you for when I can join me today. I mean, Dr. Turay. Within this Bodi Beteh Pass Gentri program, in a general physician. Areas in medicine, including orthopedics. That's people in do surgery, panel, bone thing, also geriatrician, and experiencing neurosurgery as well. So, but we decide for help with people learn because we think say knowledge is power. If you get the information, the right information, you're able to make the right decision for help you with your health condition. Go can start with presentation now. This share with screen. Right. So before we start, like I said today, like how John Fuller don't say today we talk about diabetes. Not to everything I can say we talk about diabetes. Basically, we narrow and down to we understanding waiting at the complication of diabetes. Most people we know say a well-known topic, but the complications then so much into what some people do not understand. So today one can get an overview for let people understand waiting at this diabetes, and also waiting at the complications the way they get if take necessary action. Okay, so we start with this question. I know they don't mute most of them. If you can mute people again, and TJ, I just want people from the audience, if you can tell me what you understanding about diabetes. I know say beaucoup people don't know about diabetes, but anything you know about diabetes, just tell me what you understand by diabetes. Any suggestions?
If anybody want answer, you can unmute himself. I don't enable unmute, so you can unmute yourself. Well, I'm not free to answer.
Yeah, unmute yourself if you want to answer or if you want to contribute. Any suggestion? Okay.
Thank you, say, na salon, the understanding of diabetes. So man can say, this na possible we like for it, but sugar.
Okay.
That's what they can say.
Quite right. Yes. Any other suggestion? Anybody get any other understanding? If you don't hear it, but anybody don't talk about diabetes. Say, oh, this was what way people in the talk boku, but what it actually mean.
Doc, sugar. Yo,
yeah.
I support. I concur.
Okay.
High blood sugar.
High blood sugar. Great.
Yeah.
Okay. So let's not waste time much. Let we talk about waiting we know about the complications. Wait till we know, say, complications. Do we actually know if you get any complication or you get anything that can happen if your blood sugar don't dey high for a long time?
You could go in a coma.
Exactly, yeah, good. Okay, yeah. What else?
So it can affect somebody's eyesight as well.
Okay, yes, affect your eyesight. Okay,
There are lots of things, but I'm going to find the other people for mention as well.
All right.
No, well, I concur that point, and I think as a novice on the topic, I'd rather listen to you than even dare.
All right. Okay. Thank you. Thank you so much, sir. Okay, so now we talk about let's start about diabetes now. Let's give basic definitions. Yeah. Diabetes, you get two types of them. You get one what they call diabetes mellitus, and you get the other they call diabetes insipidus. Now, the Greek word dia means pass or go through or go across. Yeah. Betis means to pass, to go, or to walk. So you pass through, go across, walk across, just like the urine, they pass through freely. So that's not the meaning of diabetes. And the Latin word for mellitus means honey or sweet, something sweet. Right? They mean by mellitus. So if you say diabetes, means water they pass through or something they pass through with sweet. Waiting at that thing, they can be urine. So diabetes mellitus, now the Latin and the Greek definition of the two words they didn't combine. And insipidus means something with tasteless. Urine or water with tasteless. Now, I mean by insipidus. So if somebody get diabetes mellitus previously, how they go before no self say somebody get diabetes mellitus or diabetes insipidus, if then two go wet, the person will get mellitus, way wet, they see sugar and then they go around that in wet day because it's sweet. The person will not get, we get insipidus, no, and they go to because it not get no taste panel. In our time no more in the produce. Now, these two conditions, they sometimes get similar presentations. That's why I think we put out, because the insipidus itself, they cause similar symptoms to mellitus, where they drink boku, they wet boku, but then two, they cause by two different things, and the treatment for them different. Mellitus, as we know so far, we'll get for know with time, we'll get for explain, they cause by insulin problem. Whilst insipidus, they comes by a hormone within at the brain, what they call vasopressin or antidiuretic, where they control how the water they regulate in your body. And if you lack in that day, you pass water boku. That's a different presentation for another time, if we want to talk about that. But today we focus on diabetes mellitus. Now, for let we know about diabetes, how globally it affects you, probably need formation and discuss certain things that waiting at the data we'll get so far. According to the WHO or the international, and also the International Diabetic Federation, diabetes now one of the most common global problem where they affect the health of people. So now one of the top 10 diseases that they cause death worldwide. So far, you have over 500 million people now the world currently where they live, we get diabetes. And that means 1 in 10, like we dinner, 1 out of every 10 of we get diabetes. And by 2030, that figure expected for rise. So which is why it's more important for we choose this topic today for discuss. In 2011 alone, 6.1 million people then die as a result of diabetes. So that means say in 2011, 1 person they die in every 5 seconds as a result of either diabetes or the complication. When I talk here about diabetes, I mean diabetes mellitus. And the type 2 diabetes increase sporadically throughout the years. For the past 3 decades, it don't increase, regardless of which country, whether low income, high income, rich, poor, everywhere it don't increase. And in Africa alone, 24 million adults they live with diabetes. And that figure they even more. That's not just the few studies the way they do. Now, over 1 in 2 people they live like how we did now. So every 2 person per week, 1 person day per week, per una 2, we get diabetes, we don't know say it get diabetes. Because most sometimes, they cause symptoms then. And so people, they even go for let them check for them. And so people, they don't know say they get diabetes. And in 2021, 416,000 people die with diabetes in Africa, for diabetes only on in complication. And so the WHO don't make November 14 as the day way for discuss about diabetes. And it don't make us in the World Diabetes Day. Then the target now for reduce diabetes, and it no say diabetes get relation with person we get big body or fat person, right? So get so many things then where they lead to this diabetes. When we say that the warning thing, then when are the risk factors then where they cause this diabetes? Yeah, things like the family history. So they run a family, and somebody they eat, they eat healthy, it gets too much weight, they exercise. Again, a very common in the Afro-Caribbean or the Black people and Black community. And so these are the things that we because it common in our community as well, a need for we talk about diabetes. So these are the data we get. Now, in regards to Sierra Leone, we're not able to get enough information. This is not an information we get from 2016 from WHO, where they say between 30 to say 70 years of age, the people away they get diabetes, now like 390 for men and 560 for women. Now over 70, now 170 for men and 260 women then get them. Now when it comes to death, then say about 990 men then die in that year, and 1,000 women then die in that year due to diabetes. But globally, they don't check among the conditions then, the communicable disease and other disease then in Sierra Leone, diabetes form like 2% of the population then. And the population at that time was about 6.4 million. So you calculate it would be like 129,000 people then die only in 2016 due to diabetes. And however, that figure could be high because with this data we WHO get, it's not very certain because they say they're not able to get information from the Sierra Leone, the mortality rate or data from the Sierra Leone, they're able to forget that. So this is not based on their own studies, that kind of data they will get. And they notice say people way overweight, the number of people overweight in Sierra Leone a high, up to 23.3% of people in Sierra Leone they get big body, and they're above the standard. And then the one the way they call obese, that the one the way it puts more weight per smack, based on what they call the BMI, will get calculated out the calculator, then about 6.6%. Now, when you take to the national, Sierra Leone, we would then look at diabetes, then get a plan for diabetes. However, they not get any strategic action plan for somebody who get obesity, means a weight, a fat too much, or weight just fat. And somebody will not get any, when they do anything, it just they as inactive. And they not get the guidelines, no guidelines, no data as way will push say when you get diabetes, now this first thing you do, now this treatment you first take, you go through in treatment, and when you for see person, when you for do annual checks in ordinary salon. Unfortunately, in one part of the in Europe and so, then get a guideline with the follow. We get diabetes with medication force you to give the person, where you go right through and now you monitor that person there. And so then they not in a salon. And also we not get like a standard criteria in a salon based on this, not based on WHO. They not get standard criteria for say, with this person I don't get X, Y, and Z in presentation for referral for diabetes in all day in Sierra Leone, right? So these are the things that we're lacking. However, when it comes to medication, the most common medication within the gives na salon are then sulfonylureas. Now then they call blenclanine, gliclazide, then kind of medication and they. Other medication like insulin, metformin, they'll give, but very much common, according to the data we'll get now, and they don't get like a kind facility, primary care facility where then will go do blood sugar measurements, then they do HbA1c test and all that thing, and the people they just they do on it. So many things that they were lacking in Sierra Leone setting when it comes to diabetes, which is why this is more important. And as I mentioned earlier on, beaucoup people get diabetes now the world wide, all over the world, and Africa even more. 60% of people get diabetes where they not even know say they get diabetes. Past the 10 hours they come, now where the diabetes don't go so far, so great complication where they even lead to death. So then after we then die safe, you know, with the presentation and then people will begin to say, oh, something diabetes is bigger, something not diabetes is bigger, you know. And a very difficult in Africa for people face or access the healthcare and facilities. So mostly marginalized communities, them, you know, they don't know about diabetes, you know, and most of them people get for pay out of their own pocket for buy the drugs then. Whilst in places like here, when you get diabetes, you know they buy most of the drugs then. Right now, of course, in Sierra Leone, most of the health facilities are then at the main centers. You know, the primary and secondary care is then at the main center, Freetown or Bo or McKinney or then main side and they. Whilst the other places them, the community health centers them, now then they deal with them. And then places they don't get their facilities they're not understanding and how for preventer and one and for how for refer them. You know, and by the time most people in come for see doctor now, the complication don't count now, and with it basically less they for do. So waiting at diabetes mellitus, I don't talk about high blood sugar. If you see this white thing there, nine the sugar. Normally everybody in blood they get sugar into them because that sugar that you need them for energy, right? But somebody who get diabetes is now they able for regulate the sugar, so the sugar they pass mark in body because a lack a hormone we then call insulin. Either a lack of them or they produce them enough. And so this now the type, you get different type of diabetes mellitus. You get the type 1. Previously, they call this one as a juvenile onset diabetes or insulin dependent diabetes. But now, then they don't change. And they call them type 1 diabetes or type 2 diabetes because they find out, say, people we get type 1, they occur from any age, from small to elderly person, they get type 1. And also person they get type 2 diabetes. First then we call and say adult onset because then they come occur only person we old, when an adult, or need insulin. But now we notice say person we get type 2 diabetes, they need insulin for in part of in treatment, and they occur even in young person. So you get things like moody, maturity onset diabetes of the young. These are based on the gene where they change in the person, the gene were responsible for the organ where they produce the insulin, they get problem. So then kind of people need to get diabetes at a young age, less than 25 years, and it can run a family as well. And these you get over 10 different type of them. And then you get other one they wouldn't call things like LADA, latent autoimmune diabetes of adults and all that. Then you get the diabetes now they occur with people with them pregnant. We call it gestational diabetes. Then a whole topic on its own because the woman get belly, most women they get diabetes as a result. Then after some years, we don't born, some people in the woman they come out of the diabetes, then they go back to normal, and so woman then they return back, they end up they stay with the diabetes now throughout their life. So when are the two different types, the main common one, type 1 and type 2. Now, the type 1, they occur mainly by people with the hormone we call insulin, when they regulate the sugar for able for produce the energy in the body, they're lacking that hormone there, right? Either the body need to produce at all or it produces very, very minimal. And in most cases, it will be as a result of the immunity, the immune system, they affect that organ. They call it, the pancreas or the beta cells in the pancreas, and they affect them. They cause and let able for produce this ammonia. And people always they get on and get other things like thyroid and other conditions and back. As opposed to type 2, in the happen when somebody they produce the insulin, but the body resists to them. This is where the post we get fat body. This is how it get diabetes, because in body fat, that fat the way build up in body, it resist the insulin for let it enter the body, for let it reduce the sugar after it don't eat food, so that it go produce the energy. So the sugar they build up in body because a body resists and it get fat, right? So that now one of the common thing. And other people in back where they take certain medication like corticosteroids, they lead to then getting diabetes. Now, the type 1 diabetes mostly then need insulin for let them manage them. And if they don't need insulin, it will lead to death sometimes. So they need insulin. As opposed to somebody who get type 2, they don't need insulin at the initial stage. Maybe not tablets, or you don't even need tablets, not just lifestyle change. After lifestyle change, it end up getting out of the diabetes. Whilst the person, sometimes if you not manage and through lifestyle change, you need oral tablets and insulin. So then again, the complications, then most of them get similar complications than what we get for can talk soon, right? And the both of them require lifestyle management, medical supervision, and the symptoms they mostly can be the same. So these are a combination of these are the symptoms that I don't talk about. The symptoms them, they feel thirsty all the time. They go to the toilet for wee often. They feel angry all the time. They extremely tired, especially type 1 person. They're extremely tired. If you wound, the so foot no they heal. It lost weight, right? And you get, as part of the complication, tingling sensation. So these are the symptoms then we person they get. When you get the symptoms there, it will finally you go, let them go check you. So let we watch this video. It will tell we small about diabetes. So I will pause for now.
Diabetes is a condition where your blood glucose level, also known as blood sugar level, is too high. There are two main types of diabetes, type 1 and type 2. There are also some rarer types, but they're all serious and can be diagnosed by your GP. The signs and symptoms you need to look out for are weeing often, because your body will be trying to lower your blood sugar levels by flushing out the extra sugar in your blood. This can lead to other symptoms, including feeling really thirsty or genital itching and thrush. This can happen if your wee contains a lot of sugar from your blood, because it can create an environment for fungal infections. You may also feel tired, because the sugar in your blood can't get into your cells to turn into energy. This could lead to your body trying to break down its fat stores instead, so you might find that you are losing weight without really trying to. Wounds might also take longer to heal, because high blood sugar levels can limit nutrients and oxygen from getting to your wound. And your eyesight might be blurry, as blood sugar can build up, making it harder to see. With type 1 diabetes, the symptoms can be more obvious and develop much quicker, over a few days or weeks. With type 2 diabetes, the symptoms can develop much slower, and some people may not have any symptoms. This is why some people can live with type 2 for years without realizing they have it. If you do notice any symptoms, contact your GP straight away. Getting diagnosed can be the first step to getting treatment so that you can find ways to live well with diabetes as soon as possible.
Right. So thank you so much, when I don't listen to this video. Now, the last thing where the person talking that is say the first step for you diabetes treatment and management, now forget the diagnosis. So that now the very first thing person for do, which is why many people get diabetes, they don't even know they get diabetes because they know they diagnose them. Now, but I bring up this one for let we know firstly, let we get the diagnosis right. Because in some cases, some person they go do one test no more, they say blood sugar high, then straight away say, oh, me, I don't get diabetes, or then brand and say get diabetes, will not to be the case. So according to WHO, and also the NICE guidance, National Institute of Clinical Excellence in the UK, their own way of diagnosing diabetes. Now this way, first, you do blood sugar. It can either be fasting or non-fasting. If you do fast, then do your sugar if it pass more than 7 millimoles. If you know the fast, then just check and randomly if it be more than 11.1. And in the UK here, we do mostly what they call the HbA1c. This is a test where they get the average of all the blood sugar for like 2-3 months. What they do, they use the part of the blood they call hemoglobin, right? About the red cell. They bind to the sugar, and that thing the way they bind to the sugar, that hemoglobin they bind to the sugar, now that average they take, they give the average for 2-3 months, now then they use for do a test. This they find out to be a really reliable, because they just give you a test for 1 day no more, or 2 days, for a long period. So they get a criteria where they more than 4.8 millimole or 6.5. Now then they use say it's not diabetic. But does it stop there alone? No is the answer. If somebody gets symptoms like waiting, they don't talk about the video every time they don't talk earlier on, you're thirsty all the time, go toilet faster, you wound, they heal, get boku and so food them, boku boil them, skin conditions there. Then so this you already get the symptoms. In that case, the clinician you go see the doctor or physician, go say, well, would this one test not enough for sure say you get diabetes? However, a more sensible if the clinician repeat them instead of just doing one test, they say, oh, you get diabetes. But if the person not get symptom at all, it just can't present no more today. You don't doing sugar, you not go blind that person, they say get diabetes, so you need for repeat them. Okay, and if you repeat them, it still no you repeat it day normal, then you can monitor the person. Because why is it important? Certain conditions then where they make your blood sugar naturally in your body they go. If somebody get infection, any infection, even chest infection, flu, cold, and everything, they make your sugar go up. Okay, you get any trauma, you fall down, you wound, you accident, all that, they make your blood sugar go. You go do operation. Part of the response of the body, they produce sugar. And so stress, we know people are stressed these days due to financial and other reasons, then they cause your blood sugar there, which is why you cannot rely on one single test for somebody you say you brand as diabetic. So this is very important. Now, this now we start now for talk about the complications. The complication, they get different within the classifier, but we will divide that into acute complication and chronic. The acute complications are one of them. Now, hyperosmolar hyperglycemic state. What does this mean? You get high blood sugar for a long time of period, then you begin get dehydrated, right? Your body shrink, you get better water in your body. This plus you get confusion. The sugar high in my body mostly happen to type 2 people. This why can lead, like somebody mentioned, say they lead to coma, right? So this can even lead to the person get into coma, and so this is not a medical emergency. Straight away, if you're gonna a setting where they will get for go hydrate this person, try for putting sugar down, and get emergency medical treatment. The other one where they happen, they call it ketoacidosis, diabetic ketoacidosis. Like we mentioned initially, you need insulin for let you produce your sugar, energy. Now, when this insulin not enough, the body now they begin to use the fat where you get. Now it break down for let produce this energy. And once they produce this energy, they produce a chemical or hormone called the ketones. That ketone they are very acidic. If then they build up my body for long, it make the person one where it talk. If you didn't hear in breath, they smell sweet. It make the person weak. It dehydrated, it even confused and go into coma. And again, it lead to immediate death. So this is not emergency. These are medical emergency. You know the joke with that at all. Not to where you get for go to somebody around the corner for they begin to get you. Right. So this can happen mostly in people who get type 1 diabetes, because of course they normally can use sugar, but it can happen in anybody again who get type 2 as well. And you get somebody where they get hypoglycemia, your blood sugar they go down. especially then people who they take insulin. If you don't know how they take them, you know, they're not explained to you properly. You take the insulin, drop your sugar so bad that you get this condition back where you sweat past mark, you see blood double, they even go into fit sometimes, they confuse. Then it means a need for give sugar, for bringing the sugar up, means the need for checking sugar and bringing sugar up. It can happen to somebody who get insulin or some of them medication there, sulfonylureas, we're very commonly used in Sierra Leone. Okay, so these are the complication, the immediate emergency complication. Again, then the chronic one, then we start with this now the list this with all the chronic complications. Then it gives stroke. We don't talk about stroke before, so it can that want for know about more about them. It can go to the website. You look at WBBPG on YouTube. You will see a whole presentation about stroke there, and also. They make your heart size they big. They make person in so foot. They get so foot when they well. They affect your kidney where you know they even know. They affect the blood supply now your foot, the nerve supply now your foot, and also they make you person blind. And you get a condition they call gastroparesis, where somebody they eat no more quick as they begin it don't full. The body the food they pass through now the stomach and properly. See, so all these are complications the way they happen. Now let's start with diabetic foot. What thing they happen in this condition? In diabetic foot, because of the high blood sugar, it damage the blood vessels. And when it damage the blood vessels, the wall of the blood vessels then they become porous and they are blocked. Blood supply they come to the end of the foot. From the heart, the blood supply they come. In addition, the blood supply will go supply the nerves, not the waiting the blood. Then the nerves they die because it not get energy, not get nutrients for they survive. They die. The blood vessel they die. Then eventually, if you get blockage, we know they bring water na a certain area. Now you plant they die. So the skin they begin affected. Get the skin they become hard. And sometimes you get the pressure points them, they become more soft, they become hard. Then eventually, because the nerve affected, you know they get sensation. So you go wound, you know say wound. Pass something as somebody look, you say, hey, you they bleed or you open, you look your socks, you see say they bleed Then they happen, you begin build up so foot day. That so foot continue for big and big and big. Where any kind of treatment, they take all kind of antibiotics. And then they work. The antibiotics, no, they even reach this. If they take all kinds of they work now because your blood sugar high. So this one one of the complications. So then people can get them. Some people will not know. Then we get associated and say you get so foot either now which or now other things happen to you make you so foot not well. So instead of you go through that pathway, it is sensible for let you go do your blood test and see if indeed now diabetes you get or not. And these are the things that we present, you know, like all Lentiawa mentioned. So your foot they shiny, they burn, they dull, you know, you get ache all the time now your foot, you get sensation, you get blisters them, you get cuts now your foot, the foot they smell. That way pull you way open during the end of the day, you make your socks up, you see your socks they smell, but they smell your socks and see if you get bad smell. Either it say don't develop infection day. So all these now symptoms then we person they develop 4 signs then for sure say you get diabetic foot problem. So this is how it starts. You get stages them, will classify them. It starts by you just having the skin being hard, the thing there under like the tendon when I they help for let the toe or the joints move, you know, become affected, the bone not affected, the covering of the joint not affected, but the infection they did. Then the second stage they go now, the blood supply they go, they begin the area don't begin to die. It don't penetrate through the then tendon and the bone. So now say they go it reach a stage now with no blood supply they go at all. Then as you see this person here in foot, it don't die. The tip of my see, it don't die. No blood, no they go there at all. So in that case now then the people then they take now either they go to hospital or they don't go to somebody around the corner where they go give them some kind of leaf. It don't reach that stage now. We go to hospital now. They say, hey, well this you know, but I don't pass Gary. I look like they go for operate. And then waiting they happen now. Now this they happen. It depends on how far the skin don't die. Because if they don't operate, that skin the way left so, it cause the it lead to sepsis. When that sepsis poisoning inside the blood will become poison. Where if they're not treated quickly, it make yourself they die. The person they die immediately because of that poisoning day. So based on which tissue we don't affected, now so then it cuts the thing. If so much of an not affected, then they will care for cut either up to here. So none of the operation they do for somebody, where you see somebody, they get amputation as a result of diabetes. So waiting out then they investigate and firstly, we get wound, then they for swab the wound. Carry on the lab. Let the lab go grow. Which kind bug we did it. They even know which kind antibiotics or which kind medication for kill the bug where you get. Then they can do X-ray for see if you don't involve the bone. If you don't involve the bone, some people they get osteomyelitis. And in that case, the treatment of antibiotics where they take, then you need long-term antibiotics treatment. So now why make you need for do X-ray, and sometimes when they do a test when they put some dye inside the vein for see which vein affected and see if they can do bypass surgery or other thing. Now this data we get from the Diabetes UK. Now in a week, 169 amputations and they do in the UK. Just see that you just look at that figure they yourself and determine how serious this is. That means say then they do 24 amputation a day. So every hour, then they do 1 amputation. Why? Because either somebody get diabetes, try for controlling sugar, try for doing care. 2, somebody not even no self say get diabetes, he just they go up and down normal. Pass the theory can and identity and get for cancer. And this is really see how devastating it will be with that person day in lifestyle. So this can be prevented by you checking your food every day. You get for be your own doctor first. Check your own food every day. And once in a year, go meet the clinician. Yeah, I know it may cost money for see clinician, but well, body better pass that billions with the pack na bank. That billions of pounds or millions with the pack na bank. Pay small offer, let them go see you. Just small chest no more. They see something you get sugar problem or something you not get them. See, so these are the things we need for do for let we help yourself. So I repeat again, check your foot. Check between your toes them. Sometimes fungal infection can develop the infection, it be hard sign at the skin, just like what I don't talk. Look at them. Then you see what you go do. So the key thing there, if you get the diabetes, try for control your sugar. If you're not possible to smoke, extremely advisable let you try all you can do for let's stop for smoke. And make sure every year, at least once in a year, you go see somebody, let them go check your food, let them go test you. Not just they go meet somebody corner because the person is cheap, you just go buy medicine for you. Let them check you properly, let them know what's waiting happen. And when you go meet the right person, then can you appropriate footwear? Because if you don't get the appropriate footwear, you go wound so you don't know. You get another condition we can talk about, we then call Charcot arthropathy. And for treat diabetes itself, when you get diabetic foot, you need multiple specialists there. You need an endocrinologist, you need a nurse, you need a neurologist, you need orthopedic surgeon. So all the specialists there get for come together for helping one way or the other in a journey towards this diabetic foot where you don't get for treatment. And then they give medication them, antibiotics or antifungal, and sometimes they give them the operation for bypass the blood supply to the area where tissue one for die. Now you get the other condition then called neuropathy, then a damage to the nerves. Again, this combined to the same thing, the blood supply being less, like I don't talk, make the nerve they die, and where you see the nerve healthy like this, where it die, it shrink in size, and it need able for communicate the information from the brain or the spinal cord to the skin. So you get different presentation then. The different presentation depend on the nerve are involved. The nerves then they by different size. They classify them into A, B, and C. Alpha, beta, gamma, delta. It depends on the size. The bigger the size of the nerve, with the covering around them, the faster the speed it transmits the information from your skin to the brain. And the smaller, the slower the speed they become transmitted. So some of them go either get tingling, or they get numbness, or they get burning sensation, right? So this is how it is. And so these are the complication way they get, and they get different types of this diabetic nerve damage. Either it can affect the periphery, where not just the legs, them, the hands, them, mostly like in a glove, and like we wear glove and stockings. Now that area where they able to affect you, and some thinking it affect even the internal organs. Them, the conditions there, what they call autonomic neuropathy. We'll get for talk a little bit more, where the side the nerves that we able for control, like how somebody has the beat myself, not to the control them. You're breathing up and down. Less sometimes you need to control than they, and also how the guts they move, you need to control. And so all the nerves they need to affect them. And once you don't begin to damage the nerve, for lay repair, it's very difficult. Sometimes you need to repair at all. All what you can do when this stage not reach, now for make sure it not progress further. And so now that we didn't came to manage them. So these are the presentation the way they happen. Pins and needles. So they like you foot the bone. So they foot the cold, like say na ice no more. Now they you put on an electric shock. And some of them symptoms there are some people they feel until maybe later in the day. Why? Because until quiet, and that in the day now they tend able for process, things that whilst you do in the day where they get activities, they able for, they notice say you get anything there. See, so some of them they happen at net. So these are the presentation where they happen. Then you get the car talk, the one where they affect the nerves then round, and also you get the one where it affects one specific nerve, right? Either it can be seen at the nerve where they supply the hand, so might be some people hand there it numb, because certain area they numb because the certain nerve where they go supply through the carpal tunnel, one area then you hand where the wrist, where nerve they pass they for supply your hand. That nerve they call it the carpal tunnel, where they affect that median nerve they. If nine no more affected, they can be seen at that one green 90. So when they don't on it until you hand the pain pass you get for shake your hand, sometime before you relieve them. You see, so all lengthening they can happen. So then one area no more na your ribs, na they don't nerve we supply the they affect. So it can affect different type, and it affects again a combination of nerves then. So this now be talk just now like Charcot joint, wherein the person in the get sensation in foot, blood supply not good, or it not get good sensation in foot, then it get fracture. It go broken foot, it not even know self. Sometimes it wake up at the broke foot. Pass later on when foot don't bend so accidentally sometimes they do X-ray and found out say, hey, the bone don't broke now. The foot don't broke. Why? Because it not able for recognize, it able for feel say it gets a pain when you get that injury there. While somebody will not get diabetes, or he get diabetes, a nerve not involve it, as he wound no, as if for no more broken foot, he not able to step on that foot, they said. You see? So this is not Charcot joint, so different way they manage them as well. Then you get the one way the carb don't talk affect only one nerve. The carb don't explain just no either just the carpal tunnel or just one of the nerve there or multiple nerves them. Then this one are the gastroparesis, wherein the blood supply, the nerve where they supply the muscle of the gut, and also where they help for let the gut move, and also when the opening when you eat food, you get what they call the sphincter, where they open for let the food can down. It need to function properly. When you eat, you full quickly. You feel bloated. You get tummy pain. You feel like sick. As you eat no more, you feel like you're sick and vomiting, or you feel nauseating. And people like you lose weight and get heartburn. All the symptoms and they can happen with somebody who get already the complication of diabetes they call gastroparesis. Right. So how you go do that day? How go manage that day? You check your blood sugar first. As we talked initially, the diagnosis is the key. After that, medication they can give, where some of them they help for move the muscles of the gut so that you were able for get your food passed through. So they can even do gastric stimulation and process. They can even do Botox. So different way they would go treat the conditions. Then you get a condition where it's very important, and this can affect the life of so many people, wherein the blood supply to the nerve become affected. The nerve, where they're able to maintain the consistency of the blood vessels, not the work when your blood pressure they drop as a result of that. So if they find out say somebody sit down, we eating up, he faint, because the blood normally it's supposed to go to the brain for allow you auto-regulate. Sorry, I'm using these words. Yeah, it auto-regulates itself so that it will able to stand up and recognize say, oh, something that happen. I need for recognize the environment. When you get less blood supply to the brain, when you just move position from sitting to standing, you get fainting and dizzy. So people wouldn't get down, they will check your blood pressure, we see the up, it see say different. So then kind of people then they advise say if you gap, you get for gap slowly. So then they can happen postural hypotension, then column. It can happen back, somebody will get diabetes. And the people in back, some people in the winner, so now woman, then they get dryness in the area, the vagina area, and some of them it is prone to infection, water infection, thrush, and all that. Then the most devastating thing can happen to man them, because the nerve damage, nerve get problem, it lead to what they call it get erection problem. In private part, they able for tinap, because blood supply to the private part needed for leg is tinap, and you get nerve supply again nerve for the day. So if that did not day, it not able for function, it become impotent. Then it can affect man them, and it can affect people in lifestyle, their life generally. Some people can even result in drinking and all that. You don't see patients there in that kind of condition. They just because of that they happen. And waiting at the root cause of it, they're not diagnosed early, they're not maintain their blood sugar. And so that not the thing. Other things that can happen, like the sweat pass mark, or your body, your skin they dry, and all the things in there. So how will they do that in a day? First, we investigate, diagnose, investigate, take your blood sugar, you control your blood sugar, and apart from that, they can test for condition they call B12 deficiency, because instead gets symptoms that present, like say, the nerve problem, and the thyroid asset, they can check them. So if now one nerve, they can do what they call nerve conduction studies then, where you go now then to the doctor so that they will be able to know if not nerve problem. So the treatment here is try for control your blood sugar, stop smoking, control the fat where you eat, and also people away because the food is sensitive, where they don't net, they can get what they call this bed cradle, so that your cloth no they touch your skin, because it's touch the skin, they become so sensitive, they even forget better sleep. You see, so all them things that you can do, and we get nerve medications and back what they give for prevent, for manage the thing, manage your symptoms. You see, so this work can affect people, it can lead to death, it can lead to people in lifestyle being so bad. Then the other condition where can happen now, it affect you, it cause gum disease. And how this they happen? Too much blood sugar, they go to the saliva, the bacteria or the bugs them, they bug them, or the jams them, then like sugar. Just like with somebody and the initial state was somebody went to get diabetes, the antigen they go in. So the bugs they make they like sugar. So then they develop, then sugar, then they eat up the gum slowly, like if you see this is not healthy gum, then they eat your gum. First they cause inflammation, redness and swelling and all. Then they begin build up plaques them inside the color of the teeth, they change. You see this posture in teeth color, they change. Then as they go, now so it widen the gum, it begin get bleeding in between. See bleeding now you gum, where they brush your teeth now morning bleed, you see a red now, and you see this fungal infection all they develop inside then inside now it begin go, it eat the bone inside the socket, inside the bone it eat up, say it reach now, so either teeth fall off or your teeth they become like so. So you can even, some people they even develop abscess inside the teeth, underneath the teeth, they develop a tooth abscess where you need a dentist. So this you need for flush your teeth, brush your teeth all the time, see your dentist, in combination to you managing your diabetes. The other complication now, and when you call diabetic nephropathy, means the kidney, they become affected. The kidney, they damage. The blood supply to the kidney, they become reduced. So it damage the blood supply to the kidney. And so waiting to happen at the first stage, initially, person need to get no symptoms at all. When it comes to diabetic, you need to get no symptoms. They go on like say nothing will happen with you. Pass accidentally, they begin see within the happen when somebody not get diabetes, they see the sugar they stay inside the blood. As it begin progress, they damage the kidney, the blood sugar they pass now the kidney. They go through, so where it wet, they come now. So within the happen, they get protein where for all inside the blood vessel, that protein they leak outside. So this protein where they leak outside, the urine, then they sometimes in the check. And sometimes they can check them by blood test. So that protein they now as it continue, the kidney continue to damage, now so the protein they leak out of them, and now so it cause the stages of kidney. Say to a stage where you will need for lead, then we'll maybe that do a kidney transplant, or they do an aggressive treatment of your kidney. So initially, as I say, they get no symptoms at all. Now, protein they leak through your kidney, and in combination to that, people they get high blood pressure again. So the high blood pressure plus the diabetes just they make the kidney they damage faster. So they begin see some man in foot they swell, the hands they swell, and they get blood through your wee, and they feel tired, they short of breath. As you work a small number, you don't feel short of breath. And because the kidney they struggle for clear all the bad product, then the toxins that will build up inside your body. So they need for do sometimes blood tests, they do scan of your kidney, and sometimes you need for even they go do replacement of a kidney. Now, according to some studies we didn't do now, this now the diabetes control and complication trial we didn't do, they found out say the people and do a study of over 1,400 people they didn't do test on. They notice say then people and when they reduce them blood sugar from 75 millimoles to 56 millimoles, we then do in that type 1 diabetic patient, then they notice say them complication for get diabetes complication due to the kidney it reduced by 39%. And after 6 years, it reduced by 54%. And another study we didn't do in the UK prospective diabetes studies, then look at the blood pressure. They notice that when you reduce the blood pressure just by the top number 154 to 144, they reduce that blood sugar. They notice it reduced the chance of the person getting kidney complication of diabetes by 8%. So this shows when you control your sugar, you control your blood pressure, it'll help you for letting you not go into that bad state. And so the treatment of this depend on which stage of the kidney which stage, because the kidney stages stay by 1, 2, 3 up to 4, end stage kidney failure. So it depends on that. So if you get blood pressure diabetes and you get high blood pressure, and nice advice, certain targets where you get for stop your blood, make sure your blood pressure not go above that target day. These are some of the target 130 over 80. It depends again on the stage of diabetes and the stage of high blood pressure where you get, you see. Again, the other condition that affect the eyes. What thing that happen in the eyes? The back of the eye, we know the light sensitive area of the eye, it get rich blood supply. That blood supply, because of diabetes, become affected. So it begin starts with gradually first you need to get no problem, you need to get nothing. Then as it go along, it begin get swelling of the blood vessel and call that aneurysm. Then that swelling they burst out. It become bleed inside the back of the eye. And because the blood supply to the end of the back of the eye reduce, they get more blood. The information they come say, I need more oxygen, so they get new blood vessels and they build up. All that they clog up the back of the eye, they cause you to get problem for letting you see. So these are the things where they happen in diabetes, retinopathy, where they cause to eye disease. So they make they see fine. You see like floaters, like something in the float in your eyes, or you see some kind of spots them. So this is a sign for say you need for see you ophthalmologist, let you look and also then check your sugar as well. And so at the initial stage, you need eyesight really affected. You get stages them. Wait, like this stage 1, not just the blood vessels swell, any reason. And then as they go, they begin get bleeding, they begin get all the other conditions they happen. And so you begin get blurring of your eyes, and so they're able to see. It eventually lead to blindness. So how you go do this? You need for go see a specialist, eye specialist, let them check you back of your eye. Somebody just looking at your eye from outside, they're able to see properly. Pass, then get this special test, this slit lamp and test there, where then they look really the layer of the eye at the back, and then they were able for investigate properly if you get eye problem. So the same management continue, control your blood sugar, control your blood pressure, control the fat, stop smoking, healthy balanced diet, do exercises, and even the laser treatment they can do. Once you don't begin affect your eye, the only thing they can do now for stop and let no progress further. But they're not able for reverse most of the things that will not happen. So the laser self way they do, not all it will restore your vision, but it is stop for things progressing further. Finally, all the complication we talk about are the skin. You get this thing called shin spots or diabetic dermopathy, where they get like some kind of round, oval, and dark spots them now your skin, so they can be brown, so they can look red. Some people they say, but this is not old age. It may not necessarily be not old age. If they feel like in a scale force, then later on they become flat and they dent inside. So it presents like this way, so right. They get no symptoms at all. They get painful. When you see them kind of thing, they are a sign for tell you say lago do me blood sugar. They get another condition where they call acanthosis nigricans, where like somebody get pre-diabetes can normally get them. You see like that kind of velvet skin. You see like your armpit. You look like your neck. You look like your armpit. Somebody will get fat body, or woman, you look under your breast and all that thing, and they see this velvet dark skin coloration. That they tell you say in a sign for sure say your skin they resist the sugar where you get. So you need for go do test. Then you get this condition back what they call necrobiosis lipodica, where you see this kind in black person, it can be purple and it can be like this brownish red in dark in light skinned person. It can happen like shin. Again, you need to get no symptoms at all, but these are signs for sure say diabetes day. Other thing, multiple infection. You see now the person they get thrush, they get skin infection. You see this one. You get cellulitis, an infection of the skin and your leg. All this na sign. Then some people then they get this skin, then a fungal infection under the breast. Woman can normally get and sometimes because of the sweat, where the breast they fall down underneath the breast, water they fungal they develop there and everything. All these are signs for sure say diabetes day. You need for let you go do your test and different treatments there for them. So this is a summary of all the complications them. Because of time, we'll go through them. And finally, if you not get your blood sugar control, what thing they happen to you? You're blind, you get heart attack, your kidney they fail. If you're a man, you need to function properly as man, or if you're a woman, they get dryness, infections, and you get even interest in mama and papa business, and finally they get amputation. Then you get gum disease as well. If you control them, you live a normal life like this one. So how we for do this? The first point now, diagnosis early. When you diagnose, you can get early treatment, and then you get your routine annual checks and see your specialist. Do all NCR done repeatedly. They talk about your diet, activity, medication, blood pressure control, and all them things. And so these are the things you get for see maybe say a dietitian where you go show you where you get diabetic. You get for diabetic deal with dietitians, and with the dietitians they show you waiting for do which kind of food you for eat, which kind of food you not for eat, and take your medication, control your blood sugar, and hopefully with this one it prevents you getting complication, and it treats you diabetes. If you're not type 2, you can even go out of the diabetes. If you're not type 1, continue with your insulin, but not a different presentation for another time. So until this one, we always know say, well, Bodi better pass Gentri. I tell you now, all thank you for your attention. So we can stop so for now. Thank you.
Thank you very much, Dr. Turay. Thank you so much. I believe people don't learn a lot. We don't do other diabetes topic than before. But this, I'm sure one all will agree with me, say the way I break things down. And I hope now for you waiting on our questions and stuff before we make any comment. Let's check if there's any question. Let me see. Okay, but then there are no questions at the moment. Okay. For me also, from waiting to we don't explain the signs the way we go know, even if we did a village, the signs the way we go take no, it don't explain anything. Okay. And we don't explain anything already. So it down out for we now for one. Hopefully we know, and we will know we see the signs and therefore you seek the right advice. One question we somebody asked is say, why is it common? Why make it common in African and Caribbean communities? Why make diabetes common in our community?
But that's an interesting question. But genetically, I think that based on the genes. So you say genetically, they just find out no more a common between in the African community. It's hard for you to explain why is it so. It makes it get genetic links, and again in diabetes in Africa, things like thyroid and other things then condition there as well, they. So I don't get any true reason why apart from it being a genetic link in the Afro-Caribbean community.
Well, given what you said, Andy, given the kind of food they already eat, I don't know much about science, so forgive me, my ignorance. But given that food they already eat, then more carbohydrate related.
Of course, like we don't talk the diets throughout the presentation. They talk about diets, lifestyle, and things. We Africans, we on culture, when you get big body means you live well, so people they exercise much and they and then they eat the kind of food they, of course, like how you mentioned, the kind of food they eat. Those are the environmental, factors as well, where they lead to them. But genetics again can play a role between the within the community as well.
Okay. Anne and Brian. Yes, Anne and Brian.
Good evening, Dr. Turay. That was an excellent presentation.
Thank you.
It was very, very interesting.
Thank you.
Sorry, I'll mute you.
Yeah, sorry.
Yeah, go ahead. I'm sorry.
I'm diabetic too, on diet control. I go to my GP every 6 months to have my bloods done and my urine done. Every 2 years I have my eyes tested.
Great.
And the last time I had my blood done was 6 months ago. The diabetic nurse said to me, if it's the same level as what it was the previous time, I could go into remission.
Good.
With my diabetes. So do exercise.
Good.
And do everything that I'm supposed to do.
Good.
So I just said to them, she says to me, what you doing, Anne? I said, I don't know. She said, well, keep it up.
Good.
Because obviously, you know, but it is good to have your bloods done, your urine, and to have your eyes tested. I mean, luckily, the last times I've been to have my eyes tested, it's been okay.
Good.
So it is important that you do go and have the tests done.
And it works.
And it works.
Exactly.
It can improve your diabetes.
Exactly.
If you watch what you eat, you exercise and do what they say, then you can live a normal life.
Exactly. Thank you so much, Anne.
Thank you, Dr. Turay. That was brilliant.
Yeah, thank you so much for this. You know, for you've shared your experience, which I think it's really valuable because you living with diabetes, you follow all the rules and all what you've been told to do. In the end, you leading towards remission.
Yeah,
that's what we're aiming at. We want people to follow what is being said. They will see the result.
Yeah.
And especially as we mentioned in the presentation with type 2 people, they can come off diabetes if they follow just diet. Now you're only on diet control, and you doing the annual 6 monthly checks. And I can tell you there are people who've got diabetes, they hardly ever knock the door of a doctor.
Yeah.
They only see doctor when they have, complication or serious consequences happen.
Yeah. All as I can say, Dr. Turay, is to people, please don't be frightened of going to the GP and getting checked out. It's so simple. It only takes a few minutes and it's so important, but don't be frightened because there's nothing to be frightened of.
Yeah, exactly. Thank you so much. That's very
good.
Thank
you.
Thank you very much. And Dr. Turay, I know you don't touch on this already, but this myth about I know classmates again say are they skinny people zone, but this myth about some people feel say because they're naturally slim or because they're slim, they're not susceptible for get diabetes. Waiting that you take on this, because I know you don't touch on it, but most of the time they can look more people, as you touched at the very beginning about people, people way overweight, way obese, that they can be more at risk. But what about skinny people? Because I know the last topic we talk about this, we've been talking about, so me know what's the answer. But for the benefit of the people who will not be don't see that session there and also either join late, what you go say about that?
No, I think I'm glad you used the word myth. It's a real myth because if you listen the first few slides of the presentation, we mentioned say somebody will get type 1 diabetic, they lose weight, then get small body, and somebody will get diabetes, they lose weight. So all means say when you get small body means say you not get diabetes. And part of the causes them again of diabetes, it can be autoimmune. Your body, they soldiers them, they fight against the organ where they produce this insulin. So it can happen, it can happen early to even small picking, and we make them even class type 1 as say and juvenile diabetes, because it happen to small people. And so if you get small body, not necessarily means they get diabetes. If you get big body, they leave you risk of you getting type 2 diabetes higher because your body, they get resistant to the insulin. Okay. And also if somebody, they take certain medications, steroid medications, they make your body, they even resistant to even the insulin as well.
The other question that I want to ask as well for say if there's any medication they go alter how this thing they behave.
Yeah, corticosteroids, steroid medications. Yeah, it can make person to get diabetes.
You have a question I want to ask for people already back home, because for we in Aya, it's quite common for if you get an illness, for speak to your HR, let them know waiting you can and cannot do. But for people in back home, waiting you go advise any jobs they will somebody will get diabetes, whether type 1 or type 2, any jobs in there where you go advise enough for do, maybe for example driving, anything. Is there anything where there will be restriction, or maybe they need to pay greater attention to if they get this kind of sickness?
Now, if you get diabetes and you control your diabetes well, you can get any job. You can do any kind of job if you control them. Now, if you meal insulin, now major part of your treatment, things like driving, you get for be careful. You get for get really rigorous checks before you do driving. Driving like then tipper, the HGV vehicle. If your sugar nowhere control you, they're more insulin. They stop you, then they ban you from driving and doing that, right?
Yeah, then I hope I know. So what are they trying to say now? Because for back home, we laugh for this, but really not funny, because for back home, we all at some point, in some way, directly or indirectly, we don't get people who are involved in accidents back home. And certainly, to be honest, we not really know what it cause them. We can just blame cinema, maybe the motor car not well serviced. Waiting at your advice, because me now say, I know what people say, wait is a way now they can't tell me. Waiting at your advice to them people, then we one, the one we not get them, which if or do, if you feel a certain way, then the one then we don't go hospital, don't get checked, we know see them get them, waiting I advise to the people, the way they job, where their own source of living, at work driving, or heavy vehicle driving, waiting I advise to them people in there.
Yeah, so you need for, like I be talk, it starts, you check your blood sugar. If you're not able for aware, say you get hypoglycemia, everything called hypoglycemia, awareness. Some people, they really take certain medication, they're aware, saying blood sugar don't go. So past they begin lost consciousness, begin faint and everything they drive. You understand? So the need for the regularly check your blood sugar before you set off for drive. And sometimes during the time when they drive, you need for the check your blood sugar regularly. And then they need for the do regular eye checks. They need for the check your eyes and regularly for make sure say you they see certain level they vision they will get forget before they allow you for drive certain motor car. See, so if they see properly, they see properly, then you go drive, especially with the drive now net, then they dangerous. So the things that we need for do now regular eye checks, regular sugar checks, and see if, especially if you use insulin, in most cases, as I mentioned, you for make sure say you're able for aware and for take you insulin most of the time, take you sugar before even you set off for drive. Take your blood sugar, your tester before you set off for drive. Then whilst you drive, you get for the also check again, and so that you know it will become hypoglycemic. And if you say that can happen, sometimes you get for the get some food near you where you for take, where you forget breaks, eat, so that you know go into that hypoglycemic state. Like we'll talk about the acute complications them of diabetes, then things and they. Okay, and also your nerves, then you need for the check, yearly check your nerves, check your foot, because if you know they feel, they get feeling at your leg, they get for the march, clutch, brake, and all them things, and they all them things and they can affect you. You see, okay. So certain jobs that we involve in them things and they you need for either strictly check if nana is source of your living, strictly be party with the healthcare professionals, they let them check you properly whilst they do them, or you change career to something else.
Okay. The last question I want to ask though, not for we were there, most of the time we can able manage, but on the other hand, the guys in back home as well, then get the advantage that then your food is more fresh. Some of we, now God knows where to eat now. I'm not going to go into that. When it comes to diet, one, is there a special diet where people in Kibu get easily accessible back home, where they able eat, we go help them with waiting and get? But also the other thing I want to touch on is pregnant women them as well. When it comes to the diet, then is there anything specific they go need for do if they get diabetes? Because the situation then the way somebody can get them, but a not day to that stage where they need for manage them, but when they can get pregnant, they can always advise them for then be more vigilant and stuff. Is so that two-way questions. So one for we were normal and stuff like that, which kind of diet they will go advise we easily accessible back home, people like able use for keep them on the low, but also for pregnant women them, is there any difference for the kind of food we then go eat, where they go able to manage them? If you able to explain that.
So you get a long list of food there where person for take where you get that, we not for take where you get diabetes. Anything you get for look at if you buy food, the label, the level of sugar within into them.
Hey, boss.
Any food.
Not get label.
Okay, if label not there, any food we get high sugar content into that. Anything we get high sugar content into that, then say you for avoid the thing in there. Right? So things like palmine, too much palmine because it get oil into that. Like how we don't talk, you get for mention you maintain your cholesterol level and things. Too much palmine, eating palmine too much, then they not too good, right? And maybe sometimes if you eat them brown rice, it can help. Rather than white rice, then in day. So and also fish good. I mean fish then na salon and everything. Fish good for person. So all any food we get fat too much, we get sugar too much. The list is long. I know able for mention or the all nenaya. Too much carbohydrates. Then in day you get for avoid them things and day.
Okay.
When it comes to pregnant women,
yes,
the same thing apply with you avoiding anything we get too much sugar, right? And exercises the way they do. If you're pregnant, some few exercises and the way they do, we will help you for either maintain your weight even whilst you're pregnant, and mostly whilst you don't come out of we don't born, the sugar don't go back to normal. Some people, because they're not born, they know they exercise again. Any woman we born, it gets certain residual fats where they develop. If you know work hard, exercise, look your diet for let you born them fats in they don't do the diabetes. So that's just no hard fast rule about it. Yeah.
Okay. I mean, said I've been last question before, but what I want to know, I believe say other people are going to think about this already. If somebody get diabetes, whether type 1 or type 2, is there any effect if you're not control them? Is there any effect to the pikin? Directly or indirectly?
If that for the pregnant woman.
Yes.
Yes, so you get people then they get big baby. Yeah. And you get big baby, and the woman itself they get thing called eclampsia, pre-eclampsia, they get fits, high blood pressure inside, we get the diabetes, they get seizures then, where they happen, you see. So then complication they happen when you waiting and we born the pikin back, it can get the sugar problem the day with the pikin himself, so they get for check the pikin, check you the mama and make sure say the sugar well controlled basically. And of course say it can run through the family if it be say not due to autoimmune problem. Yeah, it can run again through the family. It can maybe affect the pikin maybe from way young or throughout. Instead, we get autoimmune condition where they affect the organ where they produce the insulin. You get type 1 from way young. So then get for check the pikin.
Okay. Well, the family them, I don't hear you not get any more questions, and I don't see anybody else don't ask questions, then we don't reach the time where we for close. I don't understand about okay, somebody always is it? Oh, okay. We don't understand about follow we control we weight. We don't understand about for control with diet. I know say yes, but for people that really back up, so they can be difficult. And some of who say food now, some of who get sweet tooth. Me not to one part, me not for each of my have a problem. So then they tell like I get for remind myself for it. But the advice we the doctors they can always give we get for take ownership for your health. The advice I can give people and people in back home is if you make habits, it tell you well. They make habits say eat the right type of food. Yes or Samuela, you ask question? I see the wave you hand. Unmute yourself if you want to talk.
Okay.
Yes,
Okay. So what I want to ask is, you can see some people then drink water self, then sugar they go up. So I don't know if any advice there for them people then they ordinary water, then drink water self, then sugar they go up.
How the person don't know say if sugar go up, we don't drink water without I do not say sugar don't go up, we drink water.
Yes, because we can test them. Like sometimes we can try for game something for it, but you can say, well, in already it, make it just drink first. So we can say, well, after that drink, now we can rest small. Then you can call your attention, say, nurse, I just feel cold na my foot, or sometimes you go tell me, say, your foot they cramp, or then we go say, okay, well, I'll check your sugar back. We can even feel like, say, so you don't go down too much because you not eat. But all of a sudden, we can check and we can see, say, cow.
Well, the water itself, if the water no get sugar at all, it no go build up, increase in sugar. The sugar will increase if you get certain conditions there, either stress or something. The person already gets sugar. So when you go test her now,
Yes, he already get sugar.
Hey, already
Yes,
get
he already
high
get
blood sugar.
diabetic patient. Yes,
You already get high blood sugar. So now the high blood sugar we already get, now you don't test basically, rather than the water no go induce in high blood sugar at all. You see, so now the sugar we get now you already don't show itself so. And if it is at that moment the person gets either infection, diabetic food, or you get stress, or you get trauma or anything, then thing and they only cause and the sugar they come up. You get things that they increase the blood sugar rather than just water no by itself, without water no get sugar by itself, no the cause increase sugar. You don't get time before or get something in system where cause trigger the sugar system, the sugar for be high in the body.
Okay, I agree.
Okay. Thank you very much, man, for your contribution.
Yes, sir.
Yeah, KDC, that may go be the last question we'll go take today. I'm conscious we don't pass time. KDC?
Yeah. Yes. Did you get me?
Yes, ma'am.
Thank you very much, Mr. Turay, for a wonderful presentation. You talked earlier about that the complications, whether acute or late complications, similar between type 1 and type 2. So I want to know about these late complications, the way you described well, to we if it apply for a type 1 diabetic patient as well. Because at the end of the presentation, you've been talking again, say, now a whole other topic. So I get confused there. In the beginning, the similar type 1 and type 2 get similar complications there. Then you describe this detailed one, and then you say this one are for another topic again with a type 1. I wonder if these late complications then apply for a type 1 diabetes patient as well.
Okay, which one we mention about when we say then another? If I know the one specifically, I know say most the type 1 and type 2 get similar complications. Then yes. So which one where, if you can able remember what we mentioned, we'll say and they go be
I think so not type 1, but the most interestingly, waiting me one for know all these late complications, the way you talk about the nerves, then the this, it apply to type 1 patients them as well?
Yes is the answer.
Oh, okay. Thank you.
You're welcome.
Okay, my family them. One thing on a plenty. Thank you. We joined today. They can go around the panel for we close for today. I've been promised. I know I've been promised the last thing. So I will get a bit of good news for today, but unfortunately, in this past month, I get so busy, but by God power, the next session we will announce something. Okay. So I'll go to Dr. Angela. And since I don't know if you're online, you want to give Famble your last word today?
Thank you everybody for joining. Thank you very much, Dr. Turay. In fact, where you brought on talk, you're not getting nothing for say. It's a very detailed and educative presentation. I love the slides. I love how you break everything down. Me family, I thank you for wanna join we, wanna spread the word, and I not forget to say well, Bodi, Beteh past Gentri. Thank you.
Thank you very much, Dr. Angela. Dr. Kama, I know you be the guy, but I don't know if you're in a position for talk. Okay. All right, my family, Dr. Kama be the guy, but I don't know if he still they do. Now they want to know, I think they on the line at the moment.
TM.
There you go. Answer me. Ask you if the answer full, you answer me. Me and you can't make sure about that. No worry. Yes, Dr. Kama.
TM, yes, thank you so much. As I say, hats off to Dr. Turay. He do justice to the topic. Yeah. And as I say, I don't even know what else for add, but I've been just one, make people then be mindful. Somebody they ask about waiting they happen, but the diet back home and all that. Well, then get funde, which is really good for diabetic. Then get sweet potato. Yeah? Then you might say they cost money, but important for make you know. You say, what would they do? Like, I remember who was small. Would they eat that thing they call poche? This is not the raw rice. Put them on water and put sugar on it. Yeah? Honest to God, I just say, you know, so if we talk in our water, sometimes the water with that person drink, na sugar water. You know, and that's the thing, because water itself no get no way for add to the sugar. In fact, when the person go to a coma or something or whatever, or he get the high sugar, which we can do in the hospital, now give water, or make we see how the sugar they can down before we begin thinking about insulin, especially when they picking them. So important for me to say we diet get a lot for contribute towards which make this thing happen. Now I make you see in Nigeria or West Africa in general, like that fufu will they eat. I don't want to be, you know, name and shame or whatever. Then different diet than they clearly. Like for example, bread, you go put red palm panam. I know say thing stronger, but clearly that not to healthy diet. So obviously that's what's more thing than they. When you get the person where understand waiting for do and waiting not for do, you know full well saying that this for do. Yeah? We go talk about diabetes where the mami get belly and a one whole topic on your own. But clearly the person go born big baby, and then it go cause more cesarean section, more complication. But then could die when they do. So there's a lot more we can talk about. I mean, because diabetes now big topic. One no do. So we go for the do 2, 3 of denting then the just for make sure say we do, you know, justice to the topic. Because waiting do the diabetes need to talk to you. Now one of the sick then they will need to talk to you. When you don't know say you get them, you don't know say you get them, but you get them. Same applies to high blood pressure. Same applies to asthma. We get all denting then. So we tell Dr. Turay thank you. We tell the audience thank you for waiting them do, then left them time, all denting for do then come, can listen to it. We hope so them benefit from this. And if they do ya make them scatter the word. Make them talk about well body so that we'll be able to get more audience, but, you know, better airtime, and people then for carry the word go so that they go know exactly say well body, better past Gentri. Until next time, I tell you thank you and God bless we all.
Thank you very much, Dr. Kama. Not your Isata. How are you?
I'm good. Thank you very much. Wow, thank you so much, Dr. Turay. This was a very good session. I really enjoyed it. Very educative. All the subjects that we bring come up, they're very important. So what I can say is, if you spend money for make yourself sick, then you therefore spend money for make yourself get better. You therefore think very careful about it. So if you want to go buy sweets or you want to go buy cigarettes, just think that you spend money and think about the consequences way that they go cause to you. So now that logic they make it get in mind. A very scary, you know, we think about diabetes, the complications, thinking about blindness, amputation and things like that. So as Dr. Turay say, we all get responsibility. We're not just left for the doctors or clinicians, we therefore check ourselves, we therefore look after our health. I'm not getting much forward again. All I can say is, well, Bodi, better pass Gentri. And thank you very much for everybody who attend. And my dear sister, Titi Sivali, when I midwife, we be just asked the question just now about giving water to patients. Thanks for attending. And thank you very much, everybody, for being here tonight.
Thank you very much, Adita. Dr. Turay, over to you for your last word, then we'll send people them off for the day.
Okay, my family. Firstly, I want to thank you all for stay till the end of the session, and also for tuning in today for listening to the session. I hope we able to explain as much as possible and able to understand what are the complications of this diabetes. The key thing where we think of here is that most people that get diabetes, they don't know they get diabetes. So if you not take anything away from here when you left today, please, now a simple test. You just make that as a target, say today or tomorrow, I go make way for that do me own test. Whether I get symptoms or not get symptoms, like just go test. So, and then if you get somebody nearby you, you talk to and say, let go test. You go surprise, waiting will be the outcome. We they see this in clinics, we they see this with patients, they can almost every. So then a different thing they present with. When they check and then they begin surprise, say, oh, I get this thing here. And so they don't go far. So at the first step to everything, now the diagnosis. And secondly, if you know, say you don't get her now, you know, like I started to say, the Bodi better pass anything. Spend small no more for let you do every 6 months or every year, you go do your test. See your doctor, let them go check you annually. Let them do you, then you say MOT, let them do that MOT check for 1 year. You will see how much that they go help you and help your lifestyle and help you. Because if you stay healthy, you go able to get better job for let you go able to make more money. But if you're not healthy, you honestly be sick all the time. You don't know anything to make you sick all the time. So many things they play in your mind, you know. So at the big for let we test yourself, and also we get with sessions and where they can all the time. Please tell me which session we talk about. If we talk about just the treatment at some stage or just the diabetic in pregnancy, we're more than happy for do so. When I tell you to talk, and until we meet again, tell you thank you. We say well Bodi, a better pass Gentri. Thank you all.
Let me family, me I not get book for say I don't tell when I get this email to doctor. All the time there for do for make sure see them book my house able can to uninterrupted. So I tell on plenty thank you for one all attend. I hope see we all don't learn something, and I hope see we give pass this message to other people that is slowly try for save life. Once the recording download, I will put them on YouTube for the one day we miss the session or miss some part of them or share them. So then able share them. I will share the link in a bit. But plenty thank you. Well Bodi, better pass Gentri till we meet again. Good night.
Thank you.